Eastern Equine Encephalitis Resurgence in New Hampshire. New Hampshire recently reported its first fatal case of Eastern Equine Encephalitis Virus, EEEV, in more than a decade, a chilling reminder of the continued dangers of vector-borne diseases. The victim, a Hampstead resident, succumbed to the virus after battling severe neurological symptoms that quickly escalated to fatal consequences. This tragic event has received widespread attention and highlights the need for renewed vigilance in public health efforts and personal precautions to prevent mosquito-borne diseases. Eastern equine encephalitis is a rare but extremely deadly viral infection that is transmitted to humans through the bite of an infected mosquito. The virus is primarily found in the eastern United States, particularly in the Atlantic coastal states, as well as along the Gulf Coast and parts of the Great Lakes region. The Eastern Equine Encephalitis Virus is notorious for its severe effects on the human nervous system, often resulting in encephalitis, an inflammation of the brain that can lead to permanent neurological damage or death. New Hampshire has been fortunate not to have reported any cases of EEEV infection in the past decade. However, the recent deaths have shattered this period of relative calm, bringing the dangers of the virus back into the spotlight. The deceased, whose identity has been kept secret, was a longtime resident of Hampstead, a town known for its tranquil scenery and close-knit community. News of the death has shocked the state, with residents now on high alert and questioning the safety of outdoor activities, especially as summer continues to bring warm, mosquito-friendly weather. To understand the severity of the situation, it is important to understand what Eastern equine encephalitis means. The virus is an arbovirus, meaning it is transmitted by arthropods, in this case mosquitoes. The primary vector of Eastern equine encephalitis virus is the Culex pipiens, a mosquito that typically feeds on birds. However, when these mosquitoes come into contact with humans, either through habitat overlap or the migration of infected bird populations, the virus can be transmitted to people. The first known human case of Eastern equine encephalitis virus was reported in Massachusetts in 1938, and since then, the virus has been a persistent threat across the United States, albeit to a lesser degree. Despite the rarity of the virus, its high fatality rate is concerning. Statistics indicate that approximately 30% of those infected with Eastern equine encephalitis virus will die from the disease, and survivors often face long-term neurological complications that can severely impair their quality of life. Symptoms of EEEV infection typically appear 4 to 10 days after being bitten by an infected mosquito. Early symptoms may include fever, chills, headache, and vomiting. As the disease progresses, it can cause severe neurological symptoms such as disorientation, seizures, and coma. In the most severe cases, the virus can cause encephalitis, which is often fatal. The rapid deterioration of an Eastern equine encephalitis virus patient's health makes the virus particularly dangerous. One of the most troubling aspects of EEEV is its high mortality rate. With a mortality rate of approximately 30%, the virus is one of the deadliest mosquito-borne diseases in the United States. This number is particularly concerning when compared to other mosquito-borne viruses, such as West Nile virus, which has a much lower mortality rate. Eastern equine encephalitis virus is deadly because it attacks the central nervous system, causing encephalitis and often leading to death within a few days of symptom onset. EEEV survivors are not out of danger even after they recover from the acute phase of the disease. Many survivors are left with severe neurological damage, including cognitive impairment, paralysis, and seizures. These long-term effects can be life-altering and require extensive rehabilitation and ongoing medical care. As a result, Eastern equine encephalitis virus is a public health concern not only because of its fatality rate, but also because of the severe and lasting effects it has on survivors. While the recent deaths in New Hampshire have received widespread attention, they are not isolated incidents. Reports indicate that Eastern equine encephalitis virus has also been found in other parts of New England, including Massachusetts, where an 80-year-old man contracted the virus earlier this year. This case, along with the one in New Hampshire, suggests that EEEV may be more widespread than previously thought, raising concerns that a larger outbreak could be imminent. The government response to the re-emergence of Eastern Equine Encephalitis Virus was swift and comprehensive. In New Hampshire, local authorities implemented a series of measures designed to reduce the risk of further infection. These measures included temporarily closing parks, playgrounds, and other outdoor facilities in the evening and at night when mosquitoes are most active. The decision to close these areas was not made lightly, but it reflects the seriousness that public health officials take the threat of Eastern Equine Encephalitis Virus. In addition to closing public places, health officials are actively encouraging residents to take personal precautions to protect themselves from mosquito bites. These precautions include wearing long sleeves and long pants, using insect repellents containing DEET, and avoiding outdoor activities at dawn and dusk when mosquitoes are most active. Residents are also advised to take steps to reduce mosquito breeding sites around their homes, including removing standing water and ensuring window screens are intact and have no holes.